Good, good morning, Delia. Welcome to our India Home Sessions. Delia Cohen is a registered dietitian, has been dedicating her career to improving the nutritional well-being of older adults. She has been the director of nutrition at Springwell for the past 4 years. Prior to Springwell, she worked at Newbridge on the Charles for 7 years as senior clinical dietitian. Delia graduated from Simmons University with an MS in nutrition and health promotion. Welcome to our India Home Session, Delia. Very good to see you.
Thank you for having me.
Thank you for coming to India Home. Yes, it's all yours.
I can get started. Okay, I'm just looking here to see that in my notes here. One second. Okay, I'm gonna get started. Excellent.
Perfect.
So good morning, everyone. Like I said, thank you so much for having me. This is nice. I'm here in Boston, and I think most of you are in New York. So it's nice to see everyone that we're able to pass information through this version as well. So what I'm going to talk about today is really healthy aging through nutrition. So I wanted to start with one quote that kind of sticks with me and which I discuss often with my patients and clients when I hear comments about, oh, I can't make any changes anymore. It's too late. So it's Betty Friedan is an American writer and activist. She was a leading figure. And she said, aging is not lost youth, but a new stage of opportunity and strength. So there's always a time for us to continue and improve from where we are and help and work on our health. So what I'm going to review today is 3 topics that all of us experience every day, is maintaining a healthy lifestyle, which includes following a healthy diet, increasing our strength through exercise, and reviewing the nutrition facts label, which whenever we go into a store and buy a product, it has a label on it. And we're gonna review what makes most sense for us to buy and what are some challenges. So I'm going to start with a healthy diet. And before I really start this conversation today, I want each one of you to think of one change that you might be able to do after this presentation. I'm going to review what consists a healthy diet. And by the end of the presentation, I hope that you'll be able to think to yourself, and of course, happy to share, one change that you might be able to do. Because a healthy diet helps us increase our energy. It maximizes the potential of medications. It helps us prevent hospitalization. Once an individual is well nourished, they're less suspected to develop infections. And with infections or fall risk, we often develop if we are not well taken care of. So eating a healthy diet also prevents hospitalizations and also overall promotes well-being, feeling better mentally, physically, and health-wise. So I'm going to start talking about protein. Protein is a major component in our diet. It helps us build muscles, blood, renewing our skin, the strength of our hair and nails, and impacts our internal organs. Okay, so if you have a wound on your skin, your nails are breaking down, your hair might be falling out, all that is impacted by the amount and quality of the protein that you consume. Your strength of muscle as well, and bone health is also important. It provides enzymes that regulate bodily fluid functions, for example, fluid balance in terms of retaining and attracting water in our body. The protein also helps move nutrients around, helps move in our body, helps move the oxygen and waste through our body. Okay, it's a very important function also for our immune system. These past few years, we've all been quite inside the house because of COVID. Some immune function has been less strong. Now we're back outside. It's very important to maintain a strong immune system. And when we consume a high quality protein source, it helps our body do so. So in terms of how much you should eat, it varies. It depends on your age. It depends on your gender, your weight, whether you do physical activity or any other medical conditions that you encounter. For example, if you have some comorbidities, for example, some kidney disease, you need to look at your amount of protein that you consume. If you are dealing with wounds, you might need an increased amount of protein. But what studies have found that for older adults, 60 and above, usually, and of course, like I said, it really depends on the individual, but they found that 1 to 1.2 grams of protein per kilogram is helpful and useful to maintain a healthy lifestyle, prevent malnutrition, okay, or muscle loss, and support wound healing. And when I say wound healing, it's even if by mistake, while you're preparing food at home, you cut yourself. Sometimes if your immune system is weakened, you don't have enough protein, it will take a long time for a small cut to heal. But if you have an adequate protein intake, it will help that. If we have too much protein, it can cause dehydration. Like I mentioned, those who suffer from kidney disease have to watch the intake, since we do not want to harm the kidney or stress their work. There might be some other medical conditions that you will have to look at if you have them. So between 2020 and 2025, we have these new dietary guidelines for Americans, and that looks at all cultures, look what works best, and it's somewhat of an average that seems to have some health benefit and like maintaining well-being. What they found is that the diet quality is highest among older adults compared to other ages, and it's thought to be because older adults mostly are retired and have the time to think about the quality and protein, and might have some awareness than younger generation who are often on the run, balancing many other tasks during the day and just eat as you go. Many of the older adults, which is a little bit of a double-edged sword, spend a lot of the time at home and have the ability to pay more attention. However, what they found though is still that about 50% of women and 30% of men who are 71 and older still fall short of protein recommendations. So they do not meet their protein needs. And that happens because oftentimes if we are home, even though we might have the time to prepare the food and think and plan our menu, we're not as hungry, and maybe our portions are very small, or maybe we just might choose to have an apple or a cookie, something that does not require lots of preparation. So I would like to think about it when you're preparing your next meal. In terms of how much is recommended, is about 5 to 6.5 ounces per day. And again, depending on your calorie needs. or 3 cups of dairy, or some soy fortified alternative, 8 to 10 ounces of seafood per week, and 4 to 5 ounces of nuts or seeds and soy products per week. And I want you to think that an adequate protein amount per meal is like 3 to 4 ounces of a chicken breast, for example, or salmon. So you can just visualize that to help you identify what would work best for you. So once we even eat the protein, we need to think about how we spread it out during the day, because we can't eat all our protein in one meal. The body does not absorb more than 30 grams of protein per meal. So we want to think of spreading it out. For example, you want to try and add possibly protein to your breakfast. And if you have anything between breakfast and lunch, and then at lunch to have, and then later on at night. So some people prefer to have 3 large meals during the day. Some people prefer to have 3 small meals and in between. So you have to really plan to make sure that you're able to spread it out. And one other consideration with protein is that it helps balance your blood sugar. If any of you are monitoring your blood sugars or have type 2 diabetes, it's very important for blood glucose control. It helps really monitor. The carbohydrates often take up your blood sugars pretty high, depending on what you eat. The protein helps balance it. So here are some foods high in protein, and I think some are relevant to us and what we eat and some are less, but this is just a list to give you an idea. We have, it's a generic list. We have canned beans that a half amount will provide 6 to 9 protein. So if you want to have about 30 protein, depending again on your weight, between 20 to 30 protein per day, it will help you kind of calculate per day. We have eggs, we have the chicken breast, different types of cheeses, cottage cheese. See, cottage cheese is pretty high in protein. There's Greek yogurt that is pretty high in protein as well, which is not on this particular list. Then we have turkey, so a variety of meats as well. So this is just a picture, a visual of some protein sources that you might consume during the day. We have chickpeas over here, and we have cannelli beans and lentils and kidney beans, which you want to make sure, and I'll talk about it a little bit later, but you want to make sure that you mix it with a grain in order for it to be a complete protein. If you're eating it, if you're just eating lentils alone without a grain, or if you're eating the beans alone, it will not provide you with all the amino acid which build the protein. So I'm gonna move on. So once we had a protein on our plate, we want to make sure that we also have grains. So grains are very common, and I'm sure most of you consume them with every meal. But what we want to look at is the type of grain that we have. We often consume refined grains like white rice is very common for us to consume, but unfortunately it doesn't serve us with the nutritional value that the whole grain provides us, and it's more processed. So all the nutrients are empty, like white bread, different desserts as well. It's just white. We call it empty calories. It does not provide you with any nutritional value. So if you look here, and this is, again, this is a visual just for you to understand, when we refer to whole grains, what do we mean? We actually mean the whole piece of grain. If you can see, you have the bran that is out, the outer layer, can't point, but I believe you should all see the picture. It's the outer skin. It has antioxidants, antioxidants believed to help prevent cancer and fight cancer cells. B vitamins, okay? We have protein and dietary fiber. The germ, that is that small piece, is almost like the embryo of the grain, okay? And it has a lot of B vitamin, a variety of B vitamins. It has some healthy fats, which are important as well, and minerals like magnesium and phosphorus and zinc. You see inside is the endosperm, okay, which is the biggest part of the grain. And it's really the food supply. That's how technically the grain receives its food. And it's the largest part, like I mentioned. That has the major part of the carbohydrate. So our grains are considered carbohydrate, a start. And there's some protein and some B vitamins as well, but majority is the carbohydrate. So here are some nutrients that we receive from consuming whole grains. So dietary fiber in whole grains, it's mostly fiber that helps us with satiety, helps us retain the water, okay, and then helps with constipation. We also have soluble fiber, which I'll talk a little bit later when I refer to vegetables. But this dietary fiber that is found mostly in whole grains helps with bowel movements. A lot of older adults suffer from constipation as a result of different medication, as a result of being sedentary. So the dietary fiber in whole grain supports bowel movement. Iron, okay, iron helps with carrying oxygen throughout our body. Okay, we have a protein in our body that is called hemoglobin, and it helps transport the oxygen. We have selenium and magnesium. Selenium helps us with our selenium helps us as well as magnesium. We have magnesium supports our muscle. We have healthy bones with magnesium as well. It supports us along with protein. We want to make sure that we have selenium when consuming whole grains to support our immune system. Then we have B vitamins. They help import for health in our nervous system, okay? It supports our nervous system and carry on the carbohydrate throughout the body to provide us with energy. We also have folic acid, which is important for red blood cells. So why am I even talking about consuming whole grains? A lot of people prefer eating refined grains because some are used to it, some think the taste is better. It is an acquired taste, some people prefer not, but definitely that studies have shown that is health benefits associated with consuming whole grains as well as part of a healthy diet. It helps reduces risk of stroke, type 2 diabetes, heart disease, colon cancer, tooth loss. It helps supports weight management and blood pressure control. And I highlighted the type 2 diabetes, heart disease, because it hits, and you probably have heard of it or familiar, that Indians have a higher risk of developing type 2 diabetes. And studies are not exactly sure why, but they've had some thought that maybe for some reason, as opposed to other ethnic groups, the beta cells, which are in our pancreas, help synthesize and metabolize insulin, which the insulin is the hormone that helps us regulate the blood sugars. So there might be some genetic predisposition that impacts the beta cell function. And for some reason, as we get older, the function of these beta cells decreases. And that's why they're seeing or associating there's a higher risk of type 2 diabetes in South Asian community. And again, they're still looking into it. And of course, it's still related to possibly some obesity, which definitely many other cultures unfortunately experience. But they have noticed that there is a higher rate in the culture. From type 2 diabetes, unfortunately, if it's not controlled, there are many risks associated with, complications, including like heart disease, kidney failure, wounds, difficulty healing wounds because your immune system is low. So when we, like I said, consuming whole grains and a healthy diet as a whole, it helps us support our weight management, which helps blood glucose control. It also helps blood pressure control, which is also important. So these are just some examples for you to think about when you shop, and examples of whole grain sources. So we have brown rice, we have quinoa. Okay, quinoa is also considered a full protein, a complete protein. Amaranth, which is rich in antioxidants, barley, sorghum, millet, and oats. And of course, everyone has their own preferences, but if you try to think of some, even if you make one change from white rice to brown rice, you might see some health benefits over time. So how much should we eat? So portion control is also a challenge, because when we see lots of appetizing food, it's difficult to say no or to only consume the amount. So the amount also varies depending on your weight and activity level, whether you, for example, need to count carbohydrate because you might have type 2 diabetes, whether you are on insulin. So one slice of bread is actually 15 grams of carbohydrate, which means one serving size of carbohydrate if you count carbohydrate if you have diabetes. So some people might be able to have 2 slices of bread, 1 cup of whole grain of pasta or brown rice, but that's in general what's considered one serving. But as I said, it might vary as well. So I'm going to transition here to vegetables and fruit, which we want to think of having about half of our plate of fresh vegetables, depending if some of you might cook the vegetables, so you want to think of the cooking method as well. If you're frying it, you're adding oil, you want to think about that as well. You want to consume a variety of colors. And the reason for that is so you can receive a variety of vitamins and minerals. Every color is different. Every color has different vitamins that it will provide you. Vegetables and fruit also have something that's called phytochemicals. And these phytochemicals are known to be some component in the vegetable, which is kind of hard to isolate. But it provides us, and what research has found, that it provides us with health benefits to, for example, help prevent cancer. So they used to say, consume 5 a day. So you want to think when you're preparing food, your hot meal and then your salad, you want to think that you're consuming a variety of color to help provide you with vitamin A, vitamin C, potassium, folate, okay? Vitamin C supports your immune system. Potassium helps control your blood sugar. So folate also is very important for our body. So I'm going to transition here to fat, which we add to probably most of the food as we eat. So it really depends what fat we add to our body. into our food when we eat it. Saturated fat, you might have heard of it, but unfortunately, saturated fat is pretty harmful to our body. It really raises lots of lab values. For example, cholesterol, okay, which you want to think of it when you have high cholesterol as a result of consuming high fat foods, from cooking, for example, from eating pastry and desserts that are high in sugar and high in fat. It kind of builds this plaque around your arteries. And what happens is that your arteries narrow. And once they narrow, it's more difficult for the blood to pass, and then you have increase of heart disease. So really, it's been recommended to limit your intake to less than 10% of calories per day. So it's something to look about. And some of the food sources that we have is we have saturated fat. And I'm not saying to completely limit your intake, but you want to limit your intake to less than 10%. You have ghee, you have butter, whole milk, cheese, some desserts like yogurt, some dairy products, then we have animal and meats and skin and eggs. So unless you are vegan, you mostly will come in contact if you consume these type of foods. So it's something that you truly want to take a look to help prevent these labs and then risk of diseases. Some plant sources that you might cook with are some coconut oil, palm oil, cocoa butter. So a lot of them are very high in saturated fat. And if you look at the label, you'll see that the grams of saturated fat is pretty high. But our body does need some fat. And so we have some what we would call good fat. So we have monosaturated fat and polyunsaturated fat, which actually do the opposite is what saturated fat do. They decrease harmful LDL, which is like the bad LDL cholesterol, and they help decrease total cholesterol. And like I said, all this is associated with risk of heart disease. Monosaturated fat and both polyunsaturated fat are found in like olive, canola, and peanut oil. And canola and peanut oil are controversial, but we have the same fat in the food product itself, and olives, and peanut butter, and nuts, avocados, fish, for example. We also have omega-3 and omega-6 that are found. There's in avocado, and then we have in sardines. So these fats are good for our body and are essential for some functions. So we really want to keep an eye that we have this balanced diet, limit saturated fat, and consume an adequate amount of our good fat. So then we want to think about some dairy and fortified soy alternatives that we consume. It's recommended to have about 3 servings per day, and that could be about half a cup of yogurt, a cup of milk. So it truly depends, or like 1 ounce of cheese. It depends what you would eat at home, but this is the general what is recommended. And again, the reason for that is that it provides us with essential vitamins and minerals. So calcium and vitamin D are essential for our bone health. We need vitamin D for calcium to work, okay? Calcium supports strong bones, and vitamin D helps the calcium absorb in our body and metabolize it. For older adults, it's recommended to have about 1,200 milligrams of calcium. And sometimes it's pretty challenging to get it only through diet, so there are some supplements that I encourage. We have phosphorus, we have protein, we have potassium, zinc supports wound healing, okay? Especially if you have type 2 diabetes, wound healing is quite challenging. And it's very important that we receive these nutrients to help support the wound healing. And then fluids. It's something that is forgotten very quickly because we don't necessarily feel thirsty, especially as we age. We found that we lose sense of smell, which impacts our sense of taste and also desire to eat and drink. But we often, as older adults, suffer from constipation, from urinary tract infection, and at risk of dehydration. You might have seen that someone, for example, started to become delusional, okay, very confused, wasn't quite sure why. Unfortunately, they were hospitalized. Once they were hospitalized, it was found that they had a urinary tract infection, which is unfortunately the simple reason of not drinking enough. So all this could be prevented by trying to maintain adequate fluid intake. Older adults have been caught, or even being delusional, then falling, and unfortunately all this leads to hospitalization, which can be very complicated also to get out. You might not be able to go back to your home. So drinking throughout the day and possibly having a plan for drinking water throughout the day is very helpful. So you want to think about drinking 8 cups per day of 8 ounces. And I'll just add that some individuals might have some fluid restriction. So that does not apply if you have any fluid restriction related to any other medical conditions, then this would be different and you should definitely adhere to what you've been instructed to do. But the general rule is have 8 cups of water, ideally, during the day. So I just spoke about nutrition, which is vital to help well-being and nutritional status, but it goes along with muscle mass and strength because it's very important in order for us to have the energy to feed ourselves, to be strong. If you're too weak to eat, it kind of starts a whole snowball. So our muscle mass supports our physical strength and power. It reduces risk of falls and bone structure. So remember, you want to eat enough protein and receive enough of these nutrients of calcium and vitamin D to help prevent falls and bone fractures. And it also supports a healthy metabolism at weight. So it really works hand in hand together. It varies, but some studies have shown that 70% you want to focus on diet and 30% would be on exercise. So just to show you a graphic of muscle loss, it can start at the age of 30. And then as much as we get older, okay, a combination of losing muscle and not making as much muscle. You can see here that it really goes down a lot. And between 40 to 70, we're looking at about 8% loss, and then afterwards 15% loss. And you want to think, if you exercise, you might not get stronger and more muscular, but at least you will maintain the muscle mass that you have, and that will keep you strong and healthy. So here's another picture just to show you. And if you look here, this is a cross-section scan between a 72-year-old and a 70-year-old. They have a pretty similar BMI, and BMI is just basically a ratio of your weight and height. Both of them are within normal range, okay, so a healthy weight. But what happens here is you see the normal muscle density in blue on the right in the scan. The 42-year-old is pretty good. And here we have, it gives way to low density muscle and the green marbling and fat in red and orange. So you can see that there's not much for the 42-year-old. But then the 70-year-old, there is so much red and orange, and it's just muscle mass goes down. But helping maintain it will really go long way. So just, again, it's a type of medicine, exercise. So if you don't use it, you lose it. And you want to think of even small things can help you maintain your muscle mass. You build new muscle and you prevent loss. It helps you with your speed, walking, with independence. So a lot of us want to remain at home as we age. And if we maintain strength and healthy eating habit, that will help support our body and us from like brain and mental health to stay at home and independently take care of us. We feel better, and also it helps your heart. So how much? Again, it varies, and these are just general recommendations, but you want to look at, some people who sit less and do any amount of physical activity have found to receive some health benefits. If how they're feeling, if it's their lab value, if it's managing chronic diseases, all that have found to be beneficial. So if you walk, again, based on your own level, between 20 to 40 minutes a day should be helpful. And 2 days a week, you want to think of a combination of some weight-bearing exercise, and it has to be what works for you and what is your level. Include balance training as well. If you look on the CDC website, there is some different exercises, example for older adults. One of them is just standing up by a chair and doing some sit-ups. So again, you want to tailor it to see what fits your needs. And then my last topic is for you to think about when you go to the store, because everything that I spoke about the beginning about how eating healthy diet will make much more sense for you if once you go to the store and you're able to make good choices, that will help you cook healthier at home. Of course, fruits and vegetables do not have labels if they're fresh. Frozen do have, so you can always look. But here you can see the serving size. I'm gonna go through this pretty brief, but the serving size is the amount that is recommended for you to consume per setting. So for example, like a cup of yogurt. And then you have the calories that are associated with that cup of serving. So 280 calories for that 1 cup of yogurt. And then you have the percentage daily value. So you really want to pay attention to total fat, to cholesterol, sodium, carbohydrates, if you have type 2 diabetes or type 1 diabetes, and protein. And we have everything that is 5% or less is low, and anything that is 20% or more is considered high. So we have saturated fat here. Okay, so the amount, for example, this is not yogurt, that's just an example that I gave, but saturated fat is 4.5 grams. It's high. So you want to avoid a product that is too high. Dietary fiber is very good, actually. Okay, so remember with dietary fiber, it has both soluble and insoluble, and the amount is 4 grams and it's 40%. So that's very helpful. One thing I think I did not mention earlier is that we want to aim to consume between 25 to 35 grams of fiber per day. Okay, so it might take some time to build up, but that's what we want to aim for. And then below we have vitamin D, calcium, iron, potassium. The USDA found that these are nutrients that most the individuals who live in the US are not meeting their needs. Recently, the nutrition facts label changed, and they found that these are the most useful nutrients that will be helpful for the population. So it will provide you with the amount, okay, as well as the percentage per day. And then before we just go into question, I want us to put everything together in your take-home message. And I did open my presentation with think about one change that you could possibly do after this presentation. And changes are very difficult. So even if you make one change, it will go a long way. So you can see here, this is from Tough. This is my plate that is geared for older adults. And it shows you how to consume a balanced diet. Okay, we have everything, the food groups that I've discussed. You want to limit consumptions of high foods with sugar, sodium, saturated fat, and you want to make sure that you stay active. So this is it. Thank you, everyone. Stop sharing here.
Can I ask you? I'm 75 years old and I'm vegetarian and I have pacemaker. Can I eat a brown rice or just basmati rice or jasmine rice? Which rice is better?
So I'm just gonna say that because I don't know your medical history, I can't give you a specific answer, but I will
my
tell you.
digest system is hard, not good, not that so.
Yeah, so I'll tell you that in general, what is recommended is to have brown rice, which is then would be like a whole grain and will provide you with these nutrients that will help your heart health.
Yeah, but brown rice is for digest hard, right?
Right. Yeah. It can cause constipation. Yeah. The same as white rice, though. White
but
rice.
what
Can also
about
cause
basmati rice or jasmine rice or white rice?
Yeah. Unfortunately,
Which
rice is not high in fiber. Okay. So it could cause constipation, especially depending on the amount that you have. So there are some other options that you could look at. For example, farro is higher in fiber, quinoa, so that oats. So depending what you're eating and what else you're balancing, that might be some better options. Yeah.
Okay, thank you. And carbohydrate, I have to be controlled, right? That not too much from rice and wheat flour. I'm getting, we are getting carbohydrate more. And I'm old now, 75 years. And my health is not that good. That's why how much carbohydrate, how much chapati or rice, what should quantity, how should I eat?
So the recommended amount is about half a cup per meal. So you want to think about it. So you want your plate to be mainly vegetables, and then about a half a cup, depending what carbohydrate you want to have, half a cup of the carbohydrate, like rice or quinoa. Okay, these are some other
one
options.
chapati and rice, one chapati and rice, it's okay?
It sounds okay. Yeah.
Okay, thank you.
Yeah.
And blueberry I'm eating, boiled eggs, I'm a vegetarian, but boiled eggs, that yellow part and white part, both I am eating. Is it good for digest, yellow part?
So in terms of the digestion, it's not a big impact. The egg serves as a protein mainly, okay? So it has about 6 grams of protein, okay? So you want to think about that. And then it has some other vitamins that it provides you. So you want to eat both parts of the egg to get these vitamins.
Okay. And blueberry is good for pacemaker, right?
So blueberries have a lot of antioxidant, so that will be very helpful. So yes, as a whole, it's very good. It also helps the heart. It also helps prevent cancer.
One more thing, coconut oil for cooking. I'm using coconut oil, that light for digest. Is it good for taste? And for using, which one is oil better?
Yeah, so unfortunately, coconut oil is very high in saturated fat. So it's not a healthy fat. So if you
Yeah.
can find a different alternative, that would be great. If you can find,
Which one?
if you can use, for example, olive oil, that's better. Or canola
olive oil.
oil, that's better. But unfortunately,
Okay.
the coconut oil is very high in saturated fat.
Yeah.
Then
we-
olive oil is not for digest, not hard. For digestion, is it hard or not? Olive.
Not
olive oil.
necessarily. I think there's the other issues that we are concerned with saturated fat, which are like heart disease.
Okay.
Thank you.
Thank you very much.
Let's take.
I like your way.
Let's take Neeru.
Thank you very, very much.
Question. Yeah, Neeru and Tilak, please unmute yourself.
Good morning, Miss Dahlia. It was really excellent. I just missed the beginning part, but my main issue is stiffness. My stiffness in the knee. Suddenly, I had last night the whole stiffness of my left knee above. So I put cold and hot pack. What is a good suggestion of the food I should consume or not consume? Quickly, if you can guide.
So again, it's very individualized, and I don't know your medical background and what other comorbidities you are dealing with. But I think if you focus on having a healthy diet, like I showed at the end, the plate, okay, so focus on vegetables, receiving all these vitamins and minerals, and then consuming healthy carbohydrates and lean protein, that will help with overall. So it's your weight, it's your metabolism, it's any medications that you take too. So everything has a small factor in this huge equation. So even though we kind of isolate, but I think all together might help. Yeah.
Yeah, I have other issues, heart issues, everything, but this knee is just a thing. So maybe I thought like some nutrition thing, maybe something can help me to reduce the pain or inflammation.
Yeah, so with inflammation, again, if you have this balanced diet, if there's vitamins that help, okay, that you to receive through diet will help you reduce inflammation. So vitamin E helps reduce inflammation, and zinc helps with healing. So vitamin C is very important as well. And then, so it's all interconnected. And that's why if you want to focus as a variety of vegetables, you are likely to receive them. But not one day, it has to be for a while and long-term, a healthy lifestyle, because one day will not make that difference.
I know. Thank you.
Sure.
Hi, can I say Geeta ji?
Yes, please,
Anyone?
Mother Aunty. Yeah.
Okay. Yeah, actually, I'm 84, but I'm quite healthy that way. But recently, my doctor has said that your iron is less and I'm little anemic. Well, there were some reasons. I've gone for tests and all that. Nothing seems to have come out so far. But anyway, I just wanted to know that I don't take any vitamins so far. So what should I? Iron, I don't think they want to give me, but I wanted to see what is the, I know the spinach and all that I know, but the rest, if there is something else you want to eat. And I eat like 2 chapatis if I eat chapati or rice. Although I try to eat a lot of vegetables because otherwise I get constipated if I don't eat a lot of vegetables, but still like there are some deficiencies, that's all, nothing great.
Yeah. Are you vegetarian?
Yes.
Yeah.
I mean,
Okay.
I can be eggetarian. I do eat eggs, like you said, sometimes.
Yeah. So I think you want to think that to help absorb iron in our body, okay, we need to
Yeah.
have vitamin C. So some
Vitamin?
foods that C,
C.
it
Okay.
helps absorb. So if you're eating, for
So not-
example, what's that?
Vitamin C tablets, or I can take a natural I used to take lemon juice a lot, but now I don't take because of my
Yeah,
stomach.
so I am not referring to supplements at all, because again, and this is like a big general
Right,
presentation rather than like an individual counseling.
Yeah.
So I'm only referring to foods. But if you beets have some iron in them, lentils have iron in them, you want to make sure that you have enough. But and like you mentioned, spinach, it is
Yes.
difficult. The bioavailability of iron is in these items, and these food items, is more difficult to absorb and reach. But again, your doctor will determine whether you might need a supplement, which carries its own challenges, for example, constipation.
Right.
But from foods, you have lentils, you have beets that have iron, some legumes, okay, so different beans as well. So you want to try and focus on that.
Thank you,
And then
because
if you add lemon, if you even squeeze lemon on it, okay, it can
Yes.
help with the absorption.
Okay, thank you
Yeah.
so much.
Yeah.
Thank you.
Sure.
Rita ji, please ask your question. Rita Kohli.
Hello. Your whole presentation was beautiful, fantastic. I
Thank
have
you.
a question regarding cooking oil. As you
Mhm.
mentioned that olive oil is much better than coconut oil or more saturated oil. What's your idea about or your opinion about avocado oil?
Yeah, so that's good too. So his just one thing to add to think about is that for olive oil is good for cooking, but it can't cook in high temperature because then it burns. So we don't want to use olive oil if we're frying, for example. Of course, I recommend limiting your frying, but avocado oil is great, okay? And you can cook at a higher temperature with it. That's similar to canola. So yeah, avocado is good.
Okay, thank you very much.
Yeah, sure.
Is there any other?
Can I ask something, Geeta?
Yes, Nirvandi. Go ahead.
Okay. Dahlia,
I don't
can
know
you,
who's-
I know I'm not supposed to ask too many things personal, but like in general, what vitamins take away the pain? Say like all body pain, arthritis pain. What are the good vitamins we should supplement? Example, like not the food, just say B12, magnesium, like that. I want to just jot it down.
So
Pain,
for
body pain.
inflammation, again, I'm not gonna speak about specific supplements, but I'm just gonna tell you some foods that will help you with inflammation. Is, like I said, vitamin E and vitamin C and zinc, okay? But it's a combination. It all goes with everything. So I will add phosphorus here. There's so many, and that you can receive from consuming vegetables.
No, but what about vitamin, magnesium, something good for the
Magnesium
heart?
will help. Yeah, magnesium will help for muscle. Okay, so muscle pain. Again, I don't know if your stiffness is related to muscle, if it's
No,
related to
What in
arthritis.
general, like what vitamins are in general good for? Magnesium is good for heart health. So what about the bone health, like D?
Well, you have
B12.
vitamin D. Yeah, so like I mentioned, calcium and vitamin D, all these are incredibly important for bone health and maintaining strength and building new bone. Okay, if you have, but what I'm saying is, in terms of your stiffness, I don't know if it's a muscular thing, is it arthritis or related to infection? So there's potassium.
I want to know in general.
That is important. What's that?
Potassium, liquid potassium, quinine, or anything can help for overall the body.
Yeah, I'm not gonna go into these specific details because I don't know your medical history. So I don't want to mention anything that might have some interaction with anything you take.
What about glucosamine, like vitamin in general, glucosamine? Is it good for the bone health? That's general question.
Yeah, glutamine it's part of formulation that would be like, for example, with zinc and vitamin C. If you have, for example, in the hospital or in rehab, you will have supplements that have glutamine, zinc, vitamin C, sometimes vitamin E, so it depends. Yeah, and then you might have to take zinc for like a certain amount of time, because toxicity level can be very high, can get very quickly in the body. So yeah, again, it's very individualized.
What about folic acid? What does it do in a general body? Folic acid. Folic acid.
Yes, so it helps with our red blood cells. Okay, so we need our red blood cells to carry oxygen, to move blood around. So it's very important. Yep. Brain.
Thank you.
Yeah.
Thank you. Thank you.
Yeah, absolutely.
Okay. Is there anyone else have any other questions, or like we can wind up? Please unmute yourselves if you have any other questions. Yes. Yes, I don't see anything. Yes, Dr. Rao, like you want to add
I
something?
have one question, please.
Yes.
For dry mouth, what should I do? For dry mouth.
Okay, I don't know who's asking the question, but
Dry?
for dry mouth,
Because her
yeah,
camera
that's a
is
good
off.
question. Yeah, so actually dry mouth is unfortunately often a result, a side effect of medication. So you want to take sips of water throughout the day. Sometimes people will have it with a straw, and truly keep your mouth hydrated as much as possible. And depending on how it impacts your taste, some individuals like to add something to their water, like lemon, but for some people it's too acidic. So it again really depends what you're experiencing, but I would recommend drinking small amounts of water throughout the day, and making sure that your food is moist. Okay, so not too heavy, but that is moist as well. And then possibly look at the list of medications that is causing dry mouth.
I don't take any medication, but at night I
Okay.
feel dry mouth. Yeah.
Yeah,
At
so
night.
yeah, unfortunately, it might be also related to the water, but definitely, so have a bottle of water with a straw next to your bed. And whenever you feel the dry mouth, have some water, and don't wait that you have dry mouth, have it throughout the day as well to help with that.
Okay.
You might be sleeping with your mouth open on your back as well. That might cause that.
Okay.
So,
Thank
why
you
do
very
we
much. Thank you.
Why do we have to use straw and not sip it? Why do you say use the straw?
Yeah, first, it's whatever you prefer, but for some people, because of the middle of the night, so there's more of a risk of spilling it. It's just easier even to just lean from the bed and to drink it rather than fully sit up, so just like 45 degrees. So no clinical like reason for straw versus not, just like a preference. Yeah.
Okay.
That
yes.
was great.
Yeah.
Is there anyone else? Or I think Dr. Laura left. Yes, thank you. Thank you so much, Daria, for coming to India Home and giving such a beautiful presentation with so much of valuable information, and like patiently answering all of our seniors' questions. Thank you so much.
Thank you very much.
Thank you for
Thank
having
you
me.
very much for your speech. Very good speech.
Thank you.
Thank you so much. Well, have a good
Thank
rest
you.
of your day.